Our laboratory studies the how and why some bacteria are able to take up fatty acids from their environment, fatty acids that they do not make. So, for instance, Vibrio cholera, which lives in the ocean and alternates between an aquatic and host environment, sees different fatty acids that we've discovered it can take up and use to modify its membrane and other virulence behaviors. And so we're trying to figure out, we've observed several phenotypic responses, and we're trying to discover, are there signaling pathways involved? How is this benefiting the bacteria? Or alternatively, can we take advantage of the membrane alterations to make them more vulnerable to antibiotic treatment?
And we are doing research at Erlanger Hospital, we're doing research in local PT clinics, and what we're looking at is the environment of these clinics, the microbes that are found in the environment, and pointing out in particular certain types of pathogens, they're infections that patients are contracting when they go to these clinics. And these hospital-acquired infections are a big problem nowadays.
We went and swabbed the neonatal intensive care unit for bacteria, and right now we're trying to figure out what specific environments, harbor certain levels of bacteria, and to try and give feedback to the hospital administration about cleaning practices and how they can best, effectively treat these infections that they're having in the babies in the neonatal intensive care unit.
So my research is about reducing the noise of an airplane. So I simulate and investigate the problem using a supercomputing system available at the Sim Center. So what I am doing is I am simulating the airplane and the flow around the airplane to investigate the problem of the noise and try to ultimately try to reduce the noise of an airplane.
Broadly speaking, my research looks at child and teenage citizenship and activism during social movements, and some of the particular research questions I analyze is to look at how young people perceive and understand and define their own role as citizen in the context of public leadership.
So I do a lot of research in ways in which studies of the humanities can, in fact, really enhance the work that physicians of all kinds do. They're not treating diseases, they're not treating symptoms. In my mind, they're treating people. And they need to know as much about people as they can, and studying the humanities is a great way to do that.